On behalf of Ron Robison and Gilles Courteau of the Western and Quebec Major Junior Hockey Leagues, respectfully, I'm really pleased, privileged, and excited to announce that the Canadian Hockey League has adopted the Talk Today program right across the country through our 60-member teams. It's a very, very important program. We know that almost 1 in 5 in our great country live or are exposed to some form of mental disability. We know that 75% of young people before the age of 24 will develop some form of mental disability. So it's really, really important. I mean, this is, in many ways, and I don't know if Camille would agree with the way I'm characterizing this, but it's almost a silent epidemic that really goes to the words "Talk Today," and that's what this program is all about. It was born out of a tragedy. 2 years ago, March 2014, we lost a young man, Terry Trafford, playing for one of the teams in the Ontario Hockey League, through death by suicide. It was something that we felt we owed to Terry, his family, and to our players as a whole to see what we could do to better serve the players in the whole area of mental health, and from that was born the Talk Today program.
Camille Quenneville, CMHA Ontario CEO. Certainly an exciting day in the Canadian Hockey League as Talk Today has expanded to reach all 3 leagues. Just tell us a little bit about the program.
I think it's a really exciting day. I'm immensely proud of what the Canadian Hockey League has done and what the Canadian Mental Health Association has been able to contribute to the success of this program. So the program itself has, unfortunately, a sad origin in the tragic loss of Terry Trafford in March of 2014. But through the leadership shown by the Ontario Hockey League and David Branch in particular, we put together a 4-part program that looks at training young players, raising awareness, giving them supports as needed, and really what the program has done is, we know, ensured that these young players are leaders in their understanding of mental health and suicide awareness, and they have a new and unique life skill that they'll have for the rest of their lives. So that's what I'm particularly proud of.
As Dave Branch mentioned, it's a big announcement for us. We're very happy as a Quebec Major Junior Hockey League to join the Talk Today Canadian Mental Health Program.
The Western Hockey League is delighted to follow up with the leadership shown in Ontario through David Branch and the Ontario Hockey League, and we would like to thank in particular Camille Quenneville for her tremendous support that she's provided us over the past year and for preparation for the implementation on a league-wide basis in the Western Hockey League commencing next season. In the Canadian Hockey League, we're fully committed to offering the players the best possible environment, and to do that we need to make sure we have a variety of support services. This is not certainly the first. We have many support services that are offered at the national level and through our respective regional leagues. And in the Western Hockey League cases, we have had a 20-year relationship, for instance, with the Canadian Red Cross. We've had ongoing relationships with local police services, and this past year conducted a WHL Players First Summit to bring all of the support services agencies together, including Canadian Mental Health Association, to determine how we can best deliver the programs to the players and make sure that the environment continues to be a very positive one for the players and their families.
Probably the toughest demographic we will ever try to reach is young men in that age group that consists of the Canadian Hockey League. It's the training that we provide to them is relatively intense, even if it is for a short period of time, and it's not something they would get in school. So there really wouldn't be any other way that they could access these needed understanding and support for mental health awareness. So. What the program has done is given us a platform to reach these young players, to reach that very difficult demographic, and to ensure that these young leaders go out and really normalize a discussion around mental health and really teach their peers to think of it the same way they think of their physical health.
And we've seen this program over the last year in Ontario and 20 teams taking part, and maybe some of the statistics as far as number of players and coaches and staff that have been trained?
We have trained 900 in total, which I think for a program that really is less than 2 years old is really quite extraordinary. I think it speaks to the kind of people that are associated with the Canadian Hockey League and certainly in Ontario, the Ontario Hockey League. And again, I'm immensely proud of my colleagues who have really stepped up and really engaged well to provide these supports and services. I would venture to say we have very likely saved lives, and if not literally, then certainly saved lives in the sense that we've helped people who otherwise would really be suffering with their mental health, and we've been able to encourage them to get the support that they need. And whether it's the players themselves or whether it's people that the players have come in contact with, whether it's classmates or other friends or family members for that matter, we know there's been a tremendous impact. So we're just really grateful for the opportunity the league has provided.